bacteria, Borrelia burgdorferi, which can progress from a characteristic expanding skin rash, erythema migrans, EM, to a wide variety of nonspecific systemic symptoms that can affect any part of the body. Appropriate and early antibiotic treatment can successfully treat many with the infection. However, in some people, a tick bite can lead to disseminated infection and to disabling physical, cognitive, and psychological manifestations. And some people manifest with puzzling, multiple systemic symptoms that can occur throughout the body, which lead to complex lab results. Because of this, Lyme disease has been ignored or trivialized by the medical profession for more than a quarter of a century. Many of my patients have seen 15 to 20 physicians before they walk through the doors of my office searching for answers for their treatment-resistant symptoms. Their suffering is made worse as they repeatedly face difficulty in obtaining appropriate care from often skeptical medical and insurance communities, as they unknowingly enter one of the most virulent wars between two medical camps that we have seen in our country's history. One camp, the Infectious Diseases Society of America, IDSA, believes that Lyme disease is an easily diagnosable and treatable condition. The other camp, the International Lyme and Associated Diseases Society, ILADS, believes that the blood tests to diagnose Lyme disease are highly unreliable and that 30 days of antibiotics is often insufficient. Chronically ill patients, therefore, often go from doctor to doctor searching for answers. A patient's journey typically begins with a primary care physician or a family doctor. A maximum of 30 days of antibiotics is the accepted standard of care for Lyme disease. If patients report back that they are not getting better, they are likely diagnosed as having post-Lyme syndrome, chronic fatigue syndrome, CFS, which is now often referred to as myalgic encephalomyelitis, or fibromyalgia. They are then given an antidepressant and/or the number of a local psychiatrist, or told to live with their symptoms. When a child contracts Lyme disease and can't concentrate in school and/or shows a decline in their grades and attention span, then the child must have attention deficit disorder, ADD, or perhaps there are problems at home. They are typically given Ritalin or Strattera and sent for behavioral therapy. This may help some of the symptoms, yet fail to address the root problem. Desperate patients go from their family doctors to specialists complaining of chronic fatigue, fevers, sweats and chills, stiff neck and headaches, light and sound sensitivities, dizziness, memory and concentration problems, joint aches and muscle aches that migrate around the body, tingling, numbness and burning sensations, chest pain, palpitations and shortness of breath, gastrointestinal problems, resistant urological problems, sleep disorders, and/or a whole host of psychiatric symptoms, including depression, anxiety, and irritability. Or they get saddled with diagnoses of untreatable conditions. Yet the answer might be that they are experiencing multiple systemic problems from Lyme disease and its associated infections. Lyme and other tick-borne disorders have been identified across the globe and are causing untold suffering and disability in millions of people every day. It is no wonder that Lyme and associated tick-borne diseases, TBDs, are called the Great Imitators. Modern medicine is excellent at providing care for acute diseases such as strep throat, acute bronchitis or pneumonia, urinary tract infections, and acute surgical emergencies. The medical system, however, lacks an understanding of and treatments for a myriad of chronic diseases. I have successfully treated more than 12,000 people over the past 26 years, many of whom had been misdiagnosed and given simplified medical labels. I believe that those I treat are best described as having multiple systemic infectious disease syndrome, or MSIDS. Louis Pasteur's postulate, one germ, one disease, which has been one of the hallmarks of medical diagnosis for the last century, is no longer applicable, at least in patients with multiple chronic diseases.